Good morning, everyone. I'm Carla Guadamus Davis. I am your moderator this morning for another installment of Good Morning Hallandale Beach. This is brought to you by Memorial Healthcare System. This virtual platform began during COVID, and a special thank you goes out to Hallandale Beach Chamber of Commerce CEO Norma English for launching these informative events via Zoom. This morning, we have two very special guests. First, we have Broward County Public Schools Superintendent Robert Runcie and Dr. Jennifer Goldman, board certified family physician and the chief of Memorial Primary Care. Again, my name is Carla Guadamus Davis. I am your moderator this morning. The format that we're going to use today is we're going to begin with Superintendent Robert Runcie. And then if you have any questions, please feel free to ask them via the Q&A box that you see on the right-hand screen of your monitor. We will definitely try to ask as many questions as we can. We do have an hour to fill, so we're very excited because I'm going to use one of the news terminologies. This is breaking news stuff. So we need to know what is going on. So I am going to start with Superintendent Runcie with just what is happening as of right now, 9 a.m. Thursday with Broward County Public Schools.
Well, what's happening right now is that we should have about 15,000 teachers working and engaging with over 220 or so thousand students online, engaged in remote learning. We made some significant changes from last spring when we, as you know, we had to pivot in March. We only had about a week to transition from physical school campus-based, classroom-based instruction to virtual. And there was a mix, right? There were teachers that were doing it very well. There were others that were having some struggles with it. And that was, somewhat expected because folks were transitioning into very uncertain and uncharted waters as we moved to try to figure out how we could have learning continuity in the midst of this pandemic. We took the lessons learned from that period, spent this entire summer with a laser-like focus, training our teachers, enabling them to develop their confidence and be effective in engaging our students online. And so we've been able to, I think, start the school year off. We've gotten feedback from many parents about how different it is. And I think folks are pleased with the efforts that we're making, notwithstanding it's a difficult and challenging circumstances. And look, this will never replace the value of having our schools open and our students being able to interact with their peers, engaging with their teachers, and taking advantage of all those relationships and things that you find in our schools. So we're hopeful to be able to get back to that mode, and it's probably going to occur in phases. I will say that given our continued daily review of where we are with the pandemic, the trends look very favorable. And if they can continue and we don't have some spike that emerges in a week or two from the post-Labor Day weekend, I think we'll be in a position to open our schools in October, possibly even early, very early in October. And so that's what we're doing right now. We're planning. We have a school board workshop on September 22nd that starts at 10 a.m. With our school board. It's a live public meeting. And that session, we will talk about our plans, our strategies, the timing, and processes that we'll have in place to reopen our schools. We essentially look at 5 indicators because it is the path of the disease that will drive our decisions and timing. First is where the county is in terms of the phase. Currently, Broward County's in phase 1. We need them to move to at least phase 2. In my discussions with the state, earlier this week. I believe that the county in the next few days will probably move to phase 2 if the trends continue. We also look at disease progression, right? So, what are the trends that are happening? And I think we're seeing them go in a positive direction, but we're continuing to see cases. In Broward schools alone, we've had around, the last look I had was around 362 cases as of last Friday. These are cases on our campuses that involve staff and contractors, such as many of the folks doing construction and renovation work on our campuses. So we're trying to track all of that. We also look at the ability to manage the spread, right? So the availability of rapid testing is going to be critical for us to maintain continuity of our educational environment. So you can imagine if we have a case at a school, in a classroom, it could be a student or a teacher, we're going to have to then isolate, quarantine, test folks, and our ability to have rapid testing is going to determine whether that classroom's closed for 1 or 2 days versus 2 weeks. And the same would go for an entire school. So rapid testing is going to be critical. And then we also look at what's going on with the health system capacity. Again, I think the trends have been going in a positive direction there. Dr. Goldman could probably talk more about that. And then there are district safeguards. And that is our ability to implement processes and protocols to make sure that we're able to execute on our safety, health, and sanitation things. So putting in the signage, plexiglass, having sufficient levels of personal protective equipment, masks and gowns and face coverings. All of those things need to be secured, and we need to have sufficient numbers of those. And we're talking about millions of masks and lots of cleaning supplies. We've ordered and received electrostatic misters. We're talking to the state about another type of cleaning machine that they have. A lot of different new technologies are being introduced to make sure that our schools are safe as possible. At the end of the day, we have to take sufficient measures to give our teachers and our families the confidence that they can show up on our campuses and it's going to be as safe as possible. And I'll end with this. We're never going to be 100%. You're never 100% safe on anything. Coronavirus is going to be here for a while. But we're not going to be totally imperiled by it. We're not going to let perfect stand in the way of good. We're still going to have some virus out there. I think at the end of the day, our ability to open schools is going to depend on us being able to address all of these trends and make sure we have the right protocols in place, get the infection rates down. They've been moving in the right direction. So I'm hopeful again by October, we should be able to transition to opening our school campuses. And what you'll see on the vast majority of our campuses, we'll have 2 different situations going on. We've done a number of surveys with our parents, and they always come back that a third are gonna, they wanna continue with online distance learning for a whole host of factors. Some of them have found it beneficial. It gives their families flexibility. We have many students in Broward County with underlying health conditions. In fact, there's over 85,000 students with something like asthma, diabetes. So they have concerns. Students may live in, a multi-generational household. There may be some concern there. So a third will continue online. Then we have another third that you indicated that they like to have their kids come to school a couple days a week to get the social interaction and the benefits of that. And then there's probably another third that say, hey, no matter what state the virus is in, I want my kid in school 5 days a week. So what we've determined is that if you have around 20 to 30% of the students in most of our schools in Broward County who elect to continue with e-learning connected to their neighborhood school, that will enable us to offer full-time 5 days a week for everyone else, because we can fit everyone else into our schools, and do that in a way that's consistent with CDC guidelines, making sure, you know, they have 6 feet physical distancing, significantly reducing the class size. We would utilize all of our ancillary spaces that we have in our schools, and that's the way we would make it happen. So the majority of schools in Broward County, given that scenario, will essentially open, you know, 5 days a week for most of the kids. Now, there are schools that are overcrowded or near capacity. That's probably going to be somewhere between 30 and 50 schools, where they're going to probably have to go to a hybrid format, which is, since we can't fit all the students in the school, notwithstanding the number of students who elect to stay home and do remote learning, their population numbers are still large enough that we couldn't fit all the students. So they would be on some type of hybrid schedule where students would be coming in 2 to 3 days a week. The last thing I would say is that we are going to try to manage the whole process so there's continuity and a seamless transition from e-learning to our physical campuses by maintaining schedules that our students have, right? So whether you're at home or you're in school, you should be operating off of the same schedule in terms of, you know, classes that you're going to and the type of instruction that you're having. So that way we kind of ensure that all students are kind of moving at the same level of progression. So those are just some highlights. There's a lot I could probably continue, and I'll just wait for your questions. But
Well, first,
that's where we are at the moment.
I'm gonna do the cartwheel for the parents that have been waiting for this. That Broward County Public Schools is on the road. Okay, we're gonna keep our words carefully to having some kind of opening of schools in October based on a whole host of things that need to fall in place. Is that correct?
You are correct. You summarized it very well. And what I would add to that, those host of things that need to be in place, they're trending in the right direction. And we are hopeful that by September 22nd, we'll have a public conversation about it and make a go, don't go decision in terms of the timing. But at this point, things look favorable. They could change, so we can't guarantee anything, but we at least need to plan. And we desperately want to have our kids back in schools where they belong. And that's our core work. That's our core business. And we look forward to the moment that we can make that happen.
So we have a lot of questions for you, but Superintendent Runcie, obviously this has been a health decision, and you can't make everyone happy all of the time. There has been a ton of backlash from parents that are literally blaming superintendents for these decisions and getting upset and going on social media, and everybody has just been going a little nutty, if you will. I can say that because I'm a parent of a 10-year-old daughter, so I can call other parents nutty. However, I think some of us have been able to adjust. Like, I'm in my office now. My daughter is next door in the conference room doing, well, here's the breaking news out of Miami-Dade. We don't have a platform right now in Miami-Dade. The school board at 2 a.m. in Dade County ordered to kill the K through 12 system that we've been using. That's a whole different issue. I need to get, well, this is Broward, so I can't get Carvalho here, but that's a whole different problem. But some of us have been able to adjust. Other parents have been complaining. Other parents have just been nonchalant. I guess at the end of the day, isn't it good that more parents are now aware and actually taking part in your board meetings that, honestly, whoever attended school board meetings? So now everybody wants to know everything, right? So can you enlighten us a little bit on how it's been that now all the parents have an opinion and everybody wants to get involved?
Yeah, so I'll say a few things about that. First, I want to acknowledge how difficult and challenging that this has been for many, many parents as we've transitioned to this. They've got their own struggles. Some are just, fighting to survive as we see people lose their jobs, businesses close down. They've got lots of stressors. And then having to now spend this kind of time to support your child in the educational process, and essentially being a teacher aide in most cases, has been just another added level of stress for them. So I want to acknowledge that and also thank the parents for their patience and for their engagement and their partnership and collaboration in this. You are absolutely right that I think education is fundamentally changed forever in many ways. One of those is a level of parent engagement. Yes, when we have had school board meetings in the past, we typically maybe have had a couple hundred people that would actually view the live sessions. The sessions that we have now, when we discuss school openings sessions, and we had 8 of those sessions over the course of the summer, every single week. We discussed different aspects of it. We would talk about health and sanitation. We talk about transportation, food services, all the different components, because we're literally having to reinvent everything we do in the district. But those sessions had tens of thousands of people engaged in them. So I welcome that, and we have really worked to take advantage of that. So we work with our Parent Community Involvement Task Force, which is spearheaded by one of our school board members, Lori Rich Levinson, and a community activist, Mary Fertig. It's really taken off. We did 4 sessions about a month ago for parents on how they would able to what we'd be able to do to help them and provide guidance on how they can best support their kids during this distance learning time that we're in. Those were so heavily attended. We had over 20,000 parents participating in those 4 live sessions. And then we had about another 195,000 of them go online and either view the recorded sessions or check out a lot of the resources that we put in place. That level of engagement has never been possible before. So folks have gotten used to this type of format for interacting. And instead of having to drive down to your school or school board meeting, you could sit at home, you could do it in a convenient way. And look, my view is the more engaged parents are and the more they're partnering with the district, the beneficiaries of that collaboration are going to be our kids. And so I think this is a great development, and we're going to continue that. So starting tonight, we launched another 4 sessions that are going to be covering a number of different topics. And we try to do it around grade levels, but anyone can go onto the Broward Schools website, browardschools.com, and you will be able to find the icons for Parent University and get some additional information there. And you'll find the links to the actual sessions that'll start tonight. And again, they're focused on different grade levels each night, but those have been helpful, and we're going to continue those.
I'm going to be honest with you. I'm really jealous because, again, my daughter's in the day school systems right now. And I think I mentioned this to you. We might be moving to Broward because I'm not just saying this because you're on. Your background is in technology. You were the chief technology officer when you were in the Chicago public school system. So you came to Broward School, to South Florida, with, I think, a different mindset, if you will. So you were preparing for something like this, and nobody ever thought that something like this could actually be a reality. I don't think anyone could have foreseen this. But what I'm seeing as a parent is that Broward Schools was ready as you can be. Mr. Glenn Benjamin asked a question as a parent as well. His granddaughter is in Broward School Systems, and he's just giving you great, amazing reviews. And the question to that is, are you helping other schools, especially our neighbors? I hate to keep calling out Miami-Dade, but are you trying to help the others? Have they reached out to you for assistance?
I've had, so the answer is yes. Not only are we helping other schools, we had a a unique situation here in Broward because of what we were doing, how we were progressing with the plan. National Foundation provided funding for McKinsey to come and observe what we were doing with the planning. So they packaged all of that and have now made it available to other school districts across the country to assist and help in their planning efforts, at least be a resource. On a weekly basis, I'm on calls with the Council of the Great City Schools, which represents the 70 largest school districts in the United States. That includes Miami-Dade. I'm also on the board of Chiefs for Change, which has state superintendents, district superintendents from large districts. We have weekly calls there. There's an Aspen Superintendents Network I belong to. We share conversations there. And then Florida has a Florida Association of District School Superintendents, FADS, which we also have calls every other week to share information. So I have been spending a significant amount of time sharing information with other districts. Everything we do, we publish it online. We make it available to the public. So, you know, I'll say one thing about the school systems that we do. So these are really large business enterprise at one level, right? So we're the largest employer in Broward County, over 30,000 people we employ. Our budget is over $4 billion. We have the largest transportation system. We put over 1,200 buses on the road every day. We serve over 35 million meals. At some level, this is a huge business and logistics operation, right? In addition to that, there's an art and science of how teaching and learning is done in the classroom. And so you have to have a firm understanding of both. And if you can't manage the business logistics side of it well, it's going to impact the education side. And I think some districts realize that, and I think the board realized that when they brought me here to Broward County. And so one of the things that we did and why we're in a different position than many districts is that about 5 years ago, we made a determination and looked at where we were and said, hey, you know what? We got to upgrade our technology infrastructure, and technology needs to be readily available and better integrated into the educational process. So we restructured our environment, and we created single sign-on, because prior to that, we had 20, 30 different systems. They all had their own passwords. It was crazy for teachers and students to get on. So now we consolidated all that. We force anyone doing business with the district to fit into that infrastructure and integrate into it. The other thing that we did in 2014, our voters passed a bond referendum, and some people never really think about this. They think about the renovation work that we're doing on our schools, but a significant part of it was to upgrade the technology in Broward County schools. When I got here, our student to computer ratio was greater than 6-to-1. Most of the stuff was antiquated. It was not good. And so we were able to then, through that bond referendum, upgrade our computer technology, buy more computers. In fact, we reduced the student to computer ratio from 6-to-1 to 1-to-1. That's why we've been able to give out over 120,000 computer devices to any student or family that needs one. In addition to that, we've helped to negotiate discounted internet services from AT&T and Comcast at $5 and $10 a month. And then we know there are students out there who, we've got over 5,000 homeless students in Broward County who have housing insecurity and instability. We have purchased several thousand free mobile hotspots that we give to them. So they got their computers and they got their connectivity no matter where they are. So all these things were put in place. And then about 4 years ago, we purchased a learning management system called Canvas. And it's through that system that teachers develop courses, they share content and materials. They were engaging with students where they were giving out assignments, students were submitting their work, students had access to digital resources. This had been going on in the majority of our classrooms in Broward County for the last several years, and what we call it is a blended learning environment. So even though our students were physically in school, they were interacting online with their teachers and their peers. And so when we made the transition to to this distance learning, what we effectively spent our time doing is professional development with teachers who hadn't transitioned yet, because we never made it mandatory, right? So we wanted to do it organically. So by the time we got to March 2020, when we shut down our campuses, about 2/3 of our high school and middle school teachers and students were already engaged in this blended learning platform, but only about 1/5 of our elementary. And so we spent the summer really training and working with those teachers, and the teachers that were experts, we had them helping their peers. So it was a big collaborative effort, and got everyone to be comfortable, with Microsoft Teams is what we use for online video chatting, and Canvas, which is our learning platform. So all of that infrastructure and things were in place. So we never really worried or spent time about the technology and infrastructure, because again, we had been working on that for a number of years. And I'll say this, we're not going backwards, because no matter how far we go into the future and beyond coronavirus, there's going to be a segment of parents and students who want to take advantage of the online learning piece. And you will have cases where kids they want the flexibility. Maybe the family travels a lot. They can still engage in learning, but they also can stay connected to their school, right? They can come to school and participate in the sports, the activities, the clubs, but they have the flexibility to learn from anywhere, anytime. And I think that is going to be a permanent fixture of our education model. Also, technology needs to be a permanent fixture. Every kid needs to have a computer device 24/7, so they have access to learning whenever they need to. So that's our vision for some of the things that are going to come out of this pandemic, which I think are going to bode well for the future of public education.
I applaud you for being proactive, for being, as like I said, as ready as you can be, because this did catch a lot of schools off guard, a lot of different schools all over the country, and we're talking about Florida. So who was ready and who wasn't? I'm sure some people were actually maybe giggling at you. Why are you doing all this techie stuff? We don't need it. We have schools.
Oh yeah, we had a lot of challenges on that. In fact, I remember recently one of the heads of the chairs of one of our major countywide parent groups said, years ago, you guys were like talking about this stuff, and we were like, why are they doing this? And now we see why you were doing it. It's, yeah, you have to be prepared for the future and not try to just meet it when it comes on your doorstep. And we've known for decades that public education was somewhat behind other industries, if you will, in terms of our adoption of technology. It was only a matter of time before we would get here. And by the way, this is not the last pandemic that we have. We have hurricanes and other things that potentially disrupt our schools. But with what we have in place now and how people have adjusted, I think that we are in a better place to provide continuous learning, no matter what kind of circumstances may hit us. And finally, let me just say this, and I can't say it enough. I mean, just a huge a shout out to the teachers in Broward County. They have been phenomenal in how they've stepped up, the creativity that they've had, their commitment and love for their kids. It's really been astonishing as I continue to talk with them, do chats with them as well, and just see the work they're doing. So I want to just continue to publicly acknowledge and recognize our teachers, also our education support professionals, which folks don't realize in many cases they're providing enormously valuable work in a classroom assisting teachers and students. And then of course there's all our staff that keep the system running, from our custodians to our food service workers and others. So it's, as they say, it takes a village to raise a child, and we have, I think, a great village here in Broward County.
And after this, you're actually going to be logging into a board meeting that'll finalize Broward County Public Schools teachers getting their raises. So that's
yeah. So we just 2018, 2 years ago, we went to our taxpayers and said, hey, the state isn't providing any additional dollars. Our teachers are struggling just to survive and meet cost of living. I know lots of others are, but hey, look, my view is if we take care of our teachers, we're taking care of our kids. And so we asked our taxpayers to provide some referendum dollars specifically for teachers, where 72% of those dollars went for teachers. There was some dollars for school safety and mental health. So there are two buckets of dollars, right? So there are referendum dollars where we've been able to make some good adjustments to our teacher salaries. And then the legislature this year passed House Bill 641, which provided $500 million across the state to raise the entry-level salary for teachers to $47,500. So we've been able to do that. And now after today, no teacher in Broward County will start out or make less than $47,500. So I think that's a good step in the right direction. I think we need to do a lot more. But if anything, we've learned over the past few months is how valuable, how essential, and how hard the work is that our educational professionals do.
That is amazing. Now, I guess now we have to kind of look in the crystal ball, because now we're moving from the emergency stage, which it's now obviously known that you guys were ready, moving from all of us being afraid, what do we do now? What do we do to, okay, now we have a little bit of school going on. Now you're moving into a different phase. And I know that you're still trying to get things done to implement. There are a few questions that came on the Q&A. And again, I know that things are still being developed, but one of those questions was, do you have anything in place yet if a child does have any symptoms of having COVID? What would happen at that point in the actual classroom to the child? Do we have that set in place yet?
Yes, and so I would encourage folks to go also online and look at the plans that we've put together for reopening schools. And so there's a reopening plan that was presented at a school board workshop, I think a couple weeks ago, but you can actually just go online to browardschools.com and you'll find it somewhere on that site. And it lays out all of these details, right? So in the case of a situation where a student or a teacher or someone presents symptoms, first, we just created a situation where we're going to have 2 nurses in every school. One of those nurses are going to actually manage what we call the isolation room. So when somebody's presenting symptoms, they will be moved to the isolation room. We'll gather some information. We'll make sure that they get tested. As Dr. Goldman will talk about, getting the rapid test within 24 hours is going to be critical. And then we'll be able to determine, the outcome of that. And then we will begin to further isolate and quarantine staff and students who have had direct contact. So we look at 2 levels. There's direct contact, there's indirect contact, right? And then there are different strategies based on that. So yes, we have protocols and things that we've set in place. We've done that based on guidance from our local public health officials, Paul Thacke in particular at the Broward Public Health. Also chief medical officers, such as Chief Medical Officer at Memorial, Broward Health, CDC guidance, American Academy of Pediatrics. We've been engaged with that for quite a while. And by the way, we've also garnered a lot of information from other countries overseas. We took a worldwide look at what everyone was doing and try to pull together some of the best strategies we could as we put these things together. So the answer to that is yes, and our conversation that we're going to have on September 22nd is going to get pretty granular in some areas, such as this. So this is one area that I think is a great question that people are going to want more details on. We'll go into that. I think, our staff is going to want to know, what happens to them when, they get impacted or test positive, and how is that handled from, an employment standpoint. So a lot of those details have been worked out, and they're being finalized to make sure that we're as prepared as we can on the 22nd. I'm sure other questions will come up, and as they do, we'll try to address them. And, this is a moment where we try to do everything, as we say, to recognize that we have to be flexible, we have to be agile, and we need to give people a higher level of compassion and grace during this period, because it is challenging and stressful for our employees, our parents, and everyone. So we try to practice that as much as we can in every strategy and policy that we're putting together.
Well, and just to reiterate, you have the meeting September 22nd. The plan, if the county moves to phase 2, there would be reopening of schools. However, not everyone will go back to school, because you have some parents that'll still keep their children on the virtual platform. So it'll be basically a combination, everything happening at the same time. So the question is, if those parents can keep their kids at home or take them to work or whatnot and prefer not to go back to the brick and mortar system, will you have enough teachers to handle both the virtual side of things and the in-person?
Yeah, so that's a very perceptive question, because what you find out over time is that this isn't a physical space requirement. We used to have folks come say, hey, you know what? We'll give you the Civic Center. You could set up shop there. I said, no, at some point you run out of physical teachers, right? So it doesn't matter how much space that you have. So yes, we believe that we'll have sufficient teachers. We're also prepared to send back into the classroom, if you will, our certified teaching professionals who aren't assigned to classrooms. So they could be coaches, they may work in our curriculum department, but they're certified teachers. We may need to do that if necessary, to make sure we can navigate this. And for some cases, especially our secondary cases, we're planning on introducing some additional new technologies, such as these cameras that are 360. They follow the teacher around the classroom, and it'll enable synchronous learning, right? So where the teacher is providing instruction to students directly in the classroom, those that are online can participate, at least for whole group instruction as well. So we're going to try to do that to the greatest extent possible, where in that case, we wouldn't have to have a second teacher. Like, so if you're teaching, I don't know, let's say advanced placement chemistry, we probably don't have another AP chemistry teacher in that school. So students that are in that classroom and online will be able to, at the same time, participate and at least be able to get the benefits of the teaching that'll go on during that period of time. So that'll be in place as well.
Well, Superintendent Runcie, I know you have to go soon, but you told me you have until like 9:55, so I'm going to keep you till 9:55. But I
Okay.
wanted to bring in Dr. Jennifer Goldman. I met her before last year at an amazing luncheon for breast cancer awareness, and she's a board-certified family physician and the chief of Memorial Primary Care. Memorial Healthcare System, MHS, has multiple primary care practices all over South Broward County, and all of them are NCQA Level 3 certified patient-centered medical homes. MHS is one of the largest public healthcare systems in the country and a national leader in quality care and patient satisfaction. Dr. Goldman is fluent in 3 languages, English, Spanish, Creole, and earned her medical degree from Philadelphia College of Osteopathic Medicine in 2004. Her internship and residency in family health care were completed right here in South Florida in 2007 in affiliation with Nova Southeastern University. I know I can say much more about you and how amazing Memorial Healthcare System is. So my question is, how are you all integrating your expertise with everything that we've gone through with Broward County schools?
Thank you so much for the introduction. Let me start first, though, by thanking Superintendent Runcie. This was really a phenomenal presentation, and I think that you should be so proud of your leadership during this pandemic. And we were talking prior to the start of this Zoom conversation, and just like Superintendent Runcie has physicians in his family, my family is probably 80% teachers. So very, very much respect to the educators of this world. You are definitely the frontline warriors in this pandemic. And we certainly work together in our healthcare system to support everything that the schools do to keep our children safe. So I would say as Memorial, we've certainly had a front and center role in this pandemic. We supported, as many know, the C.B. Smith Park endeavor, and we're partners with the state for the past 6 months. And the state just recently turned that into a private site with a different lab, still free for the community. And so we were proud to really support our mission of keeping the community safe and healthy by offering free testing with rapid turnaround times. And then with regard to the schools, I'm so proud of working in Memorial Primary Care, because I have to say our mission is to care for everybody regardless of ability to pay. And we have patients who have no insurance. We have patients who have insurance. We see everybody in all 10 of our practices in exactly the same fashion. And then we also have our 2 mobile healthcare centers. So the adult mobile healthcare center, as well as the pediatric mobile healthcare center from Joe DiMaggio Children's Hospital. And for years now, we've been partnering with the Broward County Schools to provide school physicals and vaccinations to children who may not be insured, and to link their families with healthcare, as well as to provide their adult parents, guardians, grandparents, etc., with the healthcare that they need. So we've really been, that's our mission, and that's what I'm so proud of. And during this time, during COVID, our mobile healthcare centers really were out in the community and continued to provide care at this time. And as the school year gets going, with many different options, as Superintendent Runcie said, for online learning as well as a hybrid model and in-person learning, we have to talk about vaccinations. And this year especially, getting a flu shot is really it can be life-saving and life-changing for those around you. And so I'm proud to say that, again, our mobile health centers have free flu shots for the community. We have always had free vaccinations for the community, and this year no different, but we're also offering flu shots for free for adult members of our community, and we continue to provide free flu shots as well as other vaccinations to children in our community. And so I think that this
I
is
want
a
to stop
huge
you
offering.
real quick. This
Sure.
is huge. What you just said is how can people, do they have to register in advance for this? Do they just show up? What is the best, because that was a great thing you just said. How can people get involved with that?
Sure. So there's information on our website on mhs.net. You can go to the primary care, Memorial Primary Care link within that. And then there is information about our mobile healthcare centers, our mobile vans, our adult mobile and our pediatric mobile van. So we have 2 ways of accessing care, because breaking down barriers to accessing care is our mission. And one way is to just go as a walk-in. However, during times of COVID, especially because of social distancing, we want to make sure that we don't have large crowds around the vans. And so what we did is we created appointments as well. And so people are free to make appointments. There are phone numbers on that website that you can access. And then you can make appointments for yourself, for your child, to get vaccinations or to get those back to school physicals, really taken care of by board certified ARNPs, PAs, and physicians. And so it's very exciting.
So if, first of all, you guys are doing an amazing job. Memorial Healthcare System has just, this is when everybody shines, right? And the opposite happens too. You're either going to shine in this particular crises that we're all see ourselves in, or you're not. And now the people that are on top of it are shining. And I believe you guys are doing an amazing job. So is there a more cohesive strategy and communication with the school system in case of any emergency or in case something happens? Has that plan been put in place yet, or is that still in the works?
So I think that we're always there to support the school system, and certainly our 5 hospitals, our pediatric hospital, and our emergency rooms are there to provide care in case of emergencies. When it comes to testing, though, for asymptomatic people, people who don't have symptoms of the virus, then going to the emergency room is not always the right option. And so we do partner with Broward County for the test sites, the COVID test sites that I was talking about. And the state has done a good job of making sure that the turnaround time for those tests has been decreased to 24 to 48 hours, and that's really important. So in case of a multiple positive cases, in either the school system or a business or anywhere for people who need testing, then one of those sites is a very good option, and the results will come back fast.
I'm getting a couple of folks that tuned in a little late. I know that we're going to replay this in the Hallandale Beach Chamber of Commerce social media portals. But just to answer a quick question, there was a parent that says, when is school starting? Okay, so really quick, September 22nd, there's a big school board meeting about all of this. Tune in, guys. You know what to do as a parent to get this information. There is talks in the works that schools will be opening in October. That is still being discussed based on Broward County going to phase number 2. So there's still a lot of things going on, parents. I know everybody wants an exact date, time. This is still all in the works, but it's being discussed. So if we continue with where we are now in our numbers being low, then this is something that is a reality for those parents that want their children to go back to school. So unless I made a mistake, Superintendent Runcie, I answered the question.
You summarize it very well. And so when we do open, we're going to maintain choice. So parents are going to have the option of sending their child to school or continuing with e-learning based on their particular circumstances.
Is there a tentative date in October to open schools if that is going to happen?
So we don't have a date set yet, but it could be as early as the first week of October. So we will see based on that conversation we have on the 22nd and what the trends look like. And again, if we as a community can continue to do those things we know that are responsible and will keep ourselves and everyone else safe, we should have no difficulty getting there, but we cannot become complacent. Let's all continue to adhere to our health and safety guidelines, if for anything, for the benefit of our kids so that they can get back in school.
Perfect. Thank you for answering that question. Dr. Goldman, I'm going to put it back to you because, as a mother of a 10-year-old, which I've said a few times because she is my world, I personally will not be sending my child to school. That is just my preferential treatment. She will do 5th grade at home and at the office, and will go to my job as long as possible till I feel confident that medically this is safe to be in an environment with a lot of children. And as we know, kids do not always have the proper hygiene. These are still children that we're talking about. So my question is, what advice do you give to parents if they do choose to go back to the brick and mortar? What should parents, because guys, this is not just about the school board and the medical experts. We as parents have to take responsibility for the hygiene of our children, for how we raise them, for how we send them to school. So when everybody wants to blame the teachers or the superintendent or whatever, we as parents have to take responsibility. So giving us some tips, what are the best advice that you can give to parents? Number one, keeping their kids clean. Should they have a couple of masks in their backpacks, wipies? What if you could give parents ideas if they're going to go back to that model?
Absolutely. So I think you said a couple of things there that are particularly important. One thing is that it is great to be able to have a choice whether or not you can or want to send your child to school. And I think for those families that have that choice, then it's a deeply personal choice and that there's no judgment with regard to that decision. I think it's also particularly important to point out that many, many families do not have that choice, and that in reality, they need to send their children back to school for a number of reasons. And so it is very important to have a safe choice, whichever way you choose for your family. And then when it comes to keeping our children safe and healthy, it's really the same advice that I give to adults, and that is that wearing a mask, and the only reason I don't have mine on is because I'm in a closed office location here, but at all times, wearing your mask is paramount to me protecting you. We wear masks not particularly to protect ourselves, but to protect the other people around us. And so it is a good deed, and teaching our children about doing a good deed for the world and a good deed for each other by protecting their friend Sam or protecting their friend Jenny from getting any germs is extremely important. And that goes for adults and children. So absolutely having extra masks available, making sure that your children know that it's not an option whether or not they want to wear a mask in school. If your family decides to send their children back to school, then it is not an option whether or not they wear a mask. They must wear a mask, and we treat it similarly to how we treat it in healthcare, which is, again, it's my role to protect you and to keep you safe. And so that's number one. Number two, with the hand washing, so important. And I think that our educators are doing a great job of really teaching children, again, how to wash their hands. I have 3 boys, ages 14, 11, and 9. And so believe me, I know from hygiene and I know from boys wanting to roll around in the mud, and it's awesome, and I wouldn't trade it for the world. But hand washing can sometimes suffer. And I tell them that sort of going like this in the water, and I'm like, where's the soap? Did you put any soap on your hands at all? Well, mommy, I'm rushing. I have to go and do this. And so really sitting down and teaching our children, and I have to say our adults, our parents, on putting soap and washing for 20 seconds or more. So what I tell my kids is sing happy birthday twice and make sure you include all the words. Don't skip all the words and, move on. And so hand washing and proper technique are important. We know this in medicine. It's probably the most simple thing that we can do to keep our patients safe. And it's still something that requires regular education, even in hospitals. And then the third thing I would say is social distancing. And this is really paramount. And this goes to what you said last, which is that our choices as families, as parents, for our children at home and our communities is going to make the difference between whether or not schools are a safe place to send children, or whether or not they become a place where infection can spread. And the reason is because if you choose to get together with a number of people outside of school, and that you're not practicing social distancing, you're not wearing masks, you're not washing your hands, then you may be carrying this virus. You may be carrying the coronavirus, COVID-19. And when you're carrying it, you may not show symptoms. And for 14 days, you may not have any idea that you have it. And even after you're positive, you may not have symptoms. And throughout that entire period, you could be spreading that virus to others who may not have symptoms and be lucky as you, or may develop severe reactions either in children or more commonly in adults and in our community members with chronic conditions. And so most importantly to all of this are the choices that we all make at home in our communities. I think that the schools are doing a great job with establishing a protocol to keep children safe and to introduce those prevention measures as well as testing when the need arises. But unless our families, our parents, take that issue seriously, then you're right when you say at the end of the day, we can't guarantee a safe school unless our families are practicing masks, washing hands, and social distancing.
I could see that as a course now in school, a Pledge of Allegiance, and now we're going to go to your hygiene class. So I just see that happening. It does take a village to make something like this work. Superintendent Runcie, I know that you have to go. Again, you're going to go to a very special meeting online to finalize Broward County Schools teachers getting their raises. Yes, they deserve it. I want to leave you with one final thought, if you could. what is the importance of having small businesses in particular, like we're with the Hallandale Beach Chamber of Commerce, which is a not-for-profit organization, and we are providing this service for free to the community. What is the importance of small businesses to unite with Broward Schools for the vision that you have so that we can all do it together?
Yeah, I mean, I think small businesses are essential to the functioning of our community. We try to the greatest extent possible engage them in a lot of the services and products and things that we procure in this district. We also recognize that we need to get our schools open because they need employees to show up. So I think that our businesses need to be partners as well, as Dr. Goldman just mentioned. Those three things that she mentioned for families and the schools, that applies to the businesses as well. So if everyone is doing those things, then we can all do our part to get our schools back together again. Yeah, we're very much connected to our small business. That's where our parents work. That's, you know, those are the folks that work with the school district as well. Many of our businesses, they adopt and or work with local schools where they have employees that continue to volunteer and provide support. Some of them provide internships and other experiences for our kids. So we're grateful for all of that. But then thank you for having me on your program, and Dr. Goldman, you're absolutely fabulous. We need to have you on our next series of our parent university seminars. I think that the things that you said were very informative and spot on in terms of what our parents need to focus on. And coming from an expert with your background certainly helps them to hear that. So thank you.
Superintendent,
All right.
one more thing. In 2016, you were the Florida Superintendent of the Year. I'm going to vote right now that you get that again because you deserve it. You've been doing an amazing job for the community, for the parents, for the teachers, for everyone who depends on people like you in this type of leadership opportunity to do the right thing. And you have been, and you're an amazing leader. And we thank you for doing what you need to do to make sure that we're safe and that our kids continue to get an education.
Thank you for that. And again, all the credit goes to our teachers and our employees who do the work on the front line every day. Thank you all. And it's great being here with the great city of Hallandale. Appreciate you all very much.
Thank you. And Dr. Goldman, it's been very nice to see you again, even if it's virtually. Again, Memorial Healthcare System was a sponsor of this very amazing event today. We thank you, Broward County School Superintendent Robert Runcie, Dr. Goldman, of course, our very special sponsors, Hallandale Beach Chamber of Commerce, Norma, you guys are amazing. We'll be back October 22nd with Commissioner Lima Taub for another Good Morning Hallandale Beach. Take care, everyone. Be safe and be kind to one another.
Thank you.